Will he play again? It's been 2 days since we first laid eyes on those horrific images of Tiger Woods' car accident. Now, after emergency surgery for severe compound leg fractures, everyone is wondering, not only will he be able to walk again, but will he be able to golf again? Today, we're giving you an inside look into Tiger's injuries and hearing from medical doctors who save patients from life-threatening injuries like his every day. We're going to start with emergency room physician Dr. Samson Davis, who has seen his fair share of car accidents in the ER. So break it down for us. How traumatic was this car accident when you compare it to some of the other ones you see?
Yeah, I mean, this was a pretty severe accident. It was a rollover accident, and you could see by the damage and the debris from the vehicle that it was pretty significant. You can look at, for us in the emergency department, we want to make sure first we stabilize the person and see if there's any neurologic injuries that sustained. But from this accident, I mean, Tiger Woods is very, very fortunate to walk away alive.
Let's just go over what actually happened. This is our best estimate. This is TMZ Sports footage showing Tiger was traveling down Hawthorne Boulevard in Los Angeles on Tuesday morning around 7 a.m. Right now, the road is known to be steep and curvy, a site of many other accidents. The police officer arrived on the scene. Right, the first ones there said it appeared that Woods had been driving at a, quote, greater speed than normal. So we think Tiger hit the center meridian strip, went over it, traveled several hundred feet. It's a long way. Hit a tree, rolled several times before finally coming to rest in the brush on the opposite side of the road. Now, according to the sheriff, there were no skid marks, indicating Tiger made no attempt to brake. So what do we know about Tiger's mental status at the time of when he was first found in this crash site?
Yeah, I mean, the first thing you want to evaluate is he conscious, which he was, and based upon what the sheriff report said, he was in good spirits. Like, he was unaware of the magnitude of the injury that he sustained. You also, what we check for is if there's any alcohol on breath or any suspicion of drug use. And from what the sheriff officers relayed is that he appeared to be conscious, sober, not under the influence, but totally unaware of how damaged his legs were.
Which could happen if you're shocked and stunned and disoriented from spinning down, a road.
Yeah, I mean, adrenaline is magic. I've seen it all. I've seen people with broken ankles run in the ER just from the shock of what just took place.
Thank you very much, Dr. Davis. All right, let's talk about what happened to Tiger once he arrived at Harbor UCLA Medical Center, where he had to undergo major orthopedic surgery. So we're joined by Dr. Vonda Wright, an orthopedic surgeon and sports medicine surgeon as well. First off, we're learning Tiger had a comminuted open fracture affecting both the upper and lower portion of the tibia and fibula. So it's a lot of words, Dr. Wright. Break this down for us. What part of the leg are we talking about, and what does it mean to have a comminuted open fracture?
Absolutely, Dr. Oz. Well, let's start with the anatomy. The tibia and fibula, in common words, are the shin bones, right? The bones in the bottom of our leg that connect our knee to our ankles. Open means that those bones, when they broke in a comminuted way, which means they simply didn't break in half. There were multiple pieces. Open means that those pieces, at least one of them, was through the skin and could be seen at the time of injury.
So Tiger's medical team says he underwent a long surgical procedure on his lower right leg and ankle using a combination of rods, screws, and pins. This is all pretty intimidating. So we know that Tiger needed a rod inserted into his tibia, specifically that big bone. What purpose does it serve, and is that rod there permanently?
Yes, now, Dr. Oz, our bones have a tremendous capacity to heal, but they will not heal sufficiently if they're allowed to move around. So the purpose of the rod, which goes right in the center of the bone, is actually to hold the pieces together so that the body can do its work. Now, in the x-ray that you showed, they chose to secure the tibia with a plate. What the doctors at UCLA have used is a rod, and it's just what it sounds like, a piece of metal that goes down the center in the hollow place of the bone, and it will hold the bone together so that Tiger's own cells can heal it.
Are you concerned at all that the fracture extended into the ankle? What does that add in complexity?
You know what? It means that, just as you suspect with the description of the accident, it was a high energy accident, so that as the energy from the motor vehicle went into his body, it exited not only through the tibia, but through the small bones of his foot and ankles. So now you've got at least 3 or 4 parts of his leg that have sustained high energy injury. So it does add time and complexity to his recovery process.
Tiger's medical team also described trauma to the muscle and the soft tissue around the bone, right? So all the tissue you can see and feel in your own leg right now. And it was so severe, apparently, that they had to release the covering of the muscles in something called a fasciotomy. Is this something that you commonly have to do for patients undergoing leg surgery?
So let's go back to the idea that this was a high energy incident. The energy not only exits the bones, but imagine all the soft tissue around it. Now, our muscles are not just free floating under our skin. They are covered in a tissue called fascia that's like a cocoon. The fascia does not stretch. So in order for the swelling of the muscle to be accommodated, the doctors had to just make a thin incision in the fascia just so the muscle has room to swell and then eventually return to normal size.
Here's why that pressure needed to be relieved as soon as possible. In your legs, represented by this, right, you have blood vessels, which are pretty important, bring all the blood down, but the leg is in a sheath to hold everything together. If the muscle, this green stuff, begins to get swollen, right? If you have an injury, for example, it gets so tight that it actually shuts the blood supply off. So no blood comes down the leg, which means you cut off circulation, leading to amputation or irreversible damage. So you can't use the foot and ankle and the rest of the leg anymore. And this happens fast, within an hour in some cases. So surgeons take a knife or scissors and they cut the thin sheath in order to free this muscle. And by doing that, you get better preservation of the connective tissue around the injury. So you no longer have the swelling from the crushed leg, preventing the blood supply from bringing you nourishing oxygen and other nutrients. So Dr. Wright, open fractures have an especially high risk of infection. And now we've actually cut the leg on purpose to allow it to decompress, which of course means you can't just put a cast on there. So is all this of concern right now for Tiger's medical team?
You know, any time that there is an open fracture with bones being extruded from the body, we have an increased worry for infection. So the fact that his medical team acted so quickly and took him directly to surgery, not only to fix his fractures, but also to wash out his injuries, was imperative. And so they will keep a very, very close eye on his leg, probably hourly, and give him antibiotics so that they can do everything possible to prevent infection.
All right, when we come back, what will Tiger's recovery look like? Will he ever play golf again? That's a big question, and it's next. It's the accident that shocked the nation. Tiger Woods' car barreled off a highway in Los Angeles, rolling several times before finally coming to a rest in some brush. So what does the future hold for Tiger? We're back with orthopedic sports medicine doctor and surgeon Dr. Vonda Wright. Dr. Wright, what does the typical recovery time look like for someone undergoing a procedure like as was required for Tiger Woods?
You know, bones in adults typically heal in 3 to 6 months. However, it's not just the bone we're concerned about in this case. We are concerned about the soft tissue, the skin, the energy that we keep talking about that transmitted through his leg. All of those things will add to the total time. Now, typically, and every single patient and injury is different, typically, we will heal this injury in 6 months to a year if everything goes perfect.
Yeah, it's still a long time for a golfer who's just come back. And does it matter at all that Tiger was also recovering from a recent back surgery and that he'd undergone 4 other procedures in the past? Did those impact his prognosis?
You know what I think what those surgeries show is his ability to heal, his stamina and determination. But as you're recovering from one surgery, the latest was a back, you're using all of that energy. But here's what we know about Tiger Woods and his capacity. He is receiving the latest in surgical technology that is actually developed during wartime. So we know that these kinds of rods have the capacity to heal, number one. Number two, he's only 45 years old and he's very strong. So he has all the stem cells and protoplasm, as we like to say, to bring him back. And he's proven multiple times that he will before. And frankly, as so many people in this country have seen, I've seen him play. And I was there on the Tour Championship in 2018 when he came back and won. So if anyone is going to beat the odds, I bet on Tiger Woods.
God willing, Tiger was going to be back on the fairway soon. He suffered a similar injury to the one Alex Smith, quarterback for the Washington football team, had about 2 years ago, and Alex is already back on the field. Takes a while, takes mental endurance and resilience, all of which Tiger has, and he's proven in the past from bouncing back from other injuries. We're all sending our prayers to Tiger. Dr. Wright, thank you very much for being with us today. We're going to keep bringing you the latest on Tiger's condition as we learn more.